It's a few minutes after 6:30. I want to thank everybody for joining us tonight on our webinar for returning to sports safely during COVID-19. This webinar is specifically for high school athletics, coaches, athletic directors, athletic trainers, parents. My name is Diana Toto. I'm the Director of Sports Medicine and Business Development for St. Barnabas Medical Center. I'm also the Director of the Morahan Health Assessment Center for Athletes. And you all joining our webinar tonight have actually driven this program for this evening. You've driven this agenda. You've contributed a lot of feedback to us over the last few months, questions, concerns about this very challenging pandemic, this very challenging time. And we're very excited to have an expert group of panelists tonight to talk to you all about those concerns and challenges, and kind of alleviate a little bit of the stress that we all have been under over the last few months, and also give you all some words of encouragement as your children and athletes get back out on the field. So we're very excited to put this on for you this evening, and we have a large number of attendees joining us tonight, so bear with us if there's any tech difficulties. We're going to power through them, and I'd like to start by introducing our moderator. Dr. Josh Bershad is our Chief Medical Officer of Rutgers Athletics. He is also Executive Vice President of Physician Services for RWJBarnabas Health, and he is a Clinical Assistant Professor for Rutgers RWJ Med School. He has been leading the COVID charge for RWJBarnabas Health and just been instrumental for our whole team here. So I'm going to let him take over the mic here.
Thank you, Diana, for the kind introduction, and welcome everybody this evening to our panel. We appreciate you all taking your time to be here tonight to discuss this important topic. I have the privilege of introducing our panelists tonight, who are all true experts in their field, who I know personally. So I'm really excited to hear what they have to say on this topic around high school sports and COVID. So first, we have Dr. Jason Kristofiak. Dr. Kristofiak is a primary care sports medicine physician. He is the medical director for sports medicine for the Morahan Center and for St. Barnabas Medical Center. And he is one of our team physicians at Rutgers Athletics as well, and a clinical assistant professor at Rutgers. Next, we have Dr. Jack Kripsak. Jack, I've also known a long time. Jack has vast experience in sports health at the professional, collegiate, high school, and club levels. He's a primary care sports medicine physician at RWJBarnabas Health and medical director at several high schools. Next, we also have Dr. Jeffrey Lander, who's the co-director of sports cardiology at St. Barnabas Medical Center and the team cardiologist for the Seton Hall University Athletics Program, and an expert in sports cardiology. Finally, we have Dr. Peter Kahnemu, who is a board-certified cognitive and behavioral therapist, an associate professor at the Rutgers Graduate School of Applied and Professional Psychology. He is the head of sports mental health for both Rutgers and Seton Hall. So another experienced professional. So we're absolutely thrilled to have all of you here tonight. We appreciate you taking the time to lead this discussion and to share your insights around this very challenging time for us in sports. I'm going to say a few brief words, and then we'll jump right into our panelists. I said first some good news, I think, is always a good way to start. When we're talking about COVID, it's nice to talk about good things first. So the good news is that the state of New Jersey is in a good spot to be starting sports. We have a low number of cases compared to certainly where we were earlier this year, which is a great spot to start. Our transmission rate, which is a number that's quoted all over the media, is around 1, meaning that each person who gets COVID is only transmitting it to approximately one other person. And when we look at the statistics for the population, the folks who we're talking about, student athletes at the high school level, first of all, only about 2.5% of COVID cases in New Jersey have taken place in the, we'll say the school-aged population in New Jersey, and less than 0.6%, 0.6% of hospitalizations have been in this population. They don't really break out the data in the state level around high school specifically, so that reflects everybody as school-aged children. So again, we haven't seen very much serious disease from COVID, and we haven't seen a lot of cases of kids who are at this age. Not to say that there haven't been any, because there certainly have, but that's good news. On a personal note, my kids, my son is right now at soccer practice for his club team, and my daughter is involved in preseason workouts for her high school team. And personally, I returned to my tennis and ultimate frisbee leagues to play. So from my perspective, obviously, I'm comfortable that we can resume sports with some caution. I don't think we can just say we're going to go resume sports without any preparedness, any thoughts, any acknowledgement of risk. And you're going to hear a theme, I think, from all of our experts, but I'll start it off in that saying that the power of sport is vast. We are all huge sport enthusiasts. We believe that sports has the power to inspire, to motivate, to shape, to mold, and to help and to heal during this time. And that's why we're even having this conversation about sports during a pandemic. Otherwise, we wouldn't be having this conversation. So as we talk about it, it's my belief that the risk of contacting COVID-19 through the actual athletic activity is relatively low. It's not zero, but it's relatively low. We haven't actually had a lot of sports activity during the time of this pandemic, but I believe the actual competition and the practice time and the training time represents a relatively low risk. However, the big however here is that all of the time that goes around practice, training, and play, the socialization time, the transportation time, the pregame dinner and the postgame celebration, and the time interacting around sports, that creates the same risk as it does for all other elements of our society. And so all that time there, everyone's close together, not just the time in sport, is a critical time. And I think if you look at what's gone on around the country in gatherings of young people, you see that that's the time where we've had challenges. And I think that that actually represents our biggest threat to sports is the non-athletic time. It's actually that socialization time. And it's not a scientific solution that prevents problems with those challenges. It's really behavioral and cultural, meaning masks, social distancing, hand washing. 3 very simple to say things for me to just spit them out like it's nothing. 3 incredibly hard things to do. Incredibly hard for us as adults, as we've seen over the last months. Even harder for young people who are in a social time and in their lives and are looking for that and craving that attention after all the time we've spent isolated from one another. So that makes for a very big challenge. And I think that that is our biggest struggle that we're going to face in trying to compete and play sports this fall, is managing that social time and that interaction time. So tonight we're going to take a little journey through the experts here and hear from each of them a little bit about their areas of expertise and their thoughts and some specific questions that many people who are listening in tonight asked us to answer. So why don't we jump in here? I'm going to ask the first set of questions to Dr. Jeffrey Lander from Sports Cardiology. So Dr. Lander, if you don't mind, if you could just give us some general statements about sports cardiology, and then I have a few questions for you specifically. Thanks, Jeff.
Sure. Thanks, Dr. Prashad. So sports cardiology really encompasses care of the heart in athletes and what we call highly active individuals. So remember that the heart's a muscle, and just like with any muscle, it adapts and changes to the demands of competitive sports. And as sports cardiologists, we're really tuned into these changes and work to differentiate those normal athletic changes from something that may be abnormal. So really part of what we do, it's kind of multifocal. In some instances, we work to evaluate athletes prior to participation. If there's an athlete who's being held out of sports temporarily, we work with these athletes and we work to get them back onto the field as quickly and as safely as possible. We work with our athletes and active individuals who may have any underlying or pre-existing cardiac issues. We work with them throughout their sports participation, not just during sports, but after sports as well. And in addition, we really work to optimize athletic performance. And probably the most important part about this is remembering that it's a multidisciplinary team approach where we really aim to involve the athlete, parents, athletic trainers, primary care doctors, and the sports medicine doctors, with the shared goal of keeping athletes active in sports. And we're really lucky, we're really fortunate here at RWJBarnabas Health that we have a wonderful multidisciplinary team where we're able to do just that.
Thank you, Dr. Lander, for that. Now let's move into some of the specific details. Maybe you could give a little comment about the specific risks to the heart and to cardiovascular risk around COVID-19. Obviously, that's been circulating in both social media and in the mainstream news, especially around sports. So obviously this is an area near and dear to you. So maybe you can give us some feedback and some commentary.
Sure, of course. Yeah, and anytime something affects the heart, we hear about it in the news. I'm sure we've all heard of, there's been several big profile cases. That Red Sox pitcher, for example, had a cardiac manifestation of COVID-19. And COVID-19, of course, is caused by one of the coronaviruses. And we do know that in the general population, it has a predilection for affecting the heart and causing potential heart issues, heart complications. It's a little bit more nuanced when we delve into sports and athletes. The reason there is most of what we know about the cardiac or heart effects of COVID-19 come from our sicker, hospitalized, older patients. In this population, the hospitalized population, we've seen anywhere from 20 to 25% of these COVID-19 patients actually have some form of cardiac effects from the virus, which is a significantly higher number than from other viruses that we've seen. It's for this reason that we've been very conservative in our recommendations in getting back to sports and what to do if an athlete's previously been or currently has been diagnosed with COVID-19. And like we mentioned, there's several different ways that the virus can affect the heart. Probably within the sports world, the biggest cardiac thing that we worry about is myocarditis. And myocarditis is inflammation of the heart muscle. And while it's relatively uncommon, it's less common in young people than it is in older people. For example, in the pediatric population, the general prevalence of myocarditis is about 1 to 2 per 100,000, as opposed to the adults. So it's about tenfold that, about 10 or so to 10 to 20 per 100,000. The reason we worry about myocarditis in particular is that it is a known risk of sudden cardiac arrest, sudden cardiac death in athletes. So that's really the big thing that we look out for when it comes to the hearts of athletes and viruses in particular, not just the coronavirus. So it's important that we take, and I'm sure you're going to hear this throughout the talk tonight, that it's important we take precautions in staying safe and getting back to sports. And before I say anything else, I'll preface all of this with, this is really a bit of a moving target at this point. This is something that's new to all of us. It's fluid, it's dynamic. Each week that goes by, we learn more and more about COVID-19 and what we can do to help prevent the spread of COVID-19 and keep our athletes safe. So one of the biggest things that we can probably do before we even get on the field or the court or the track is to take advantage of PPE. So during the pandemic, we all thought of PPE as personal protective equipment, but long before this pandemic came along, in the sport world, we all thought PPE as our pre-participation evaluation. And here in New Jersey, for high school athletes, it's mandated. Every athlete has to have a pre-participation evaluation prior to participating in sports. So I think one big thing that we can do this year is really incorporate some COVID-19 specific questions into that PPE to help weed out if anyone's been exposed or affected by the disease and pick that up even before they step foot on the field. And in keeping athletes safe, we do have to realize one important thing is that no matter how great we are in trying to pick up things before they happen, there's always going to be some risk of events. And I just want to remind everyone who's watching, parents, athletes, trainers, physicians out there, is that we really want to have an emergency action plan in place, a well-rehearsed emergency action plan in place. So in the very unlikely event that something happens, we're prepared for it and we know what to do when it does happen.
Thank you, Dr. Wayne, for the comments on myocarditis, which has been a a topic of discussion among the sports world over the last few months, and I'm sure will continue to be as more information emerges about the impact of COVID-19 on the heart, and specifically related to sports. So we're going to shift gears a little bit, and we're going to ask Dr. Economy to talk a little bit about mental health. And obviously, this is another topic that has been very prominent during our COVID-19 challenges, both for the general population, as folks have had their lives unfortunately disrupted with work schedules and challenges and illness and loss and uncertainty, and mental health issues have crept up at an alarming rate throughout the country. And obviously, mental health issues are always of concern in the student athlete population. Those in high schools especially are vulnerable to this. And so maybe Dr. Economy, maybe you can comment a little bit in general about mental health in the high school athlete population, and then we'll specifically talk about COVID. Thank you.
Thank you, Dr. Barshad. And thank you for that. And I think one of the things to think about is that it's not just the athlete. So I think as we're, for our audience, really making sure that they're focused on their own mental health, parents, athletic trainers, directors, because, you know, we're steering the ship. And so it's like they say when you're flying, make sure you put your mask on first. And that's a big thing in this, is make sure your mask is on. And this is, as we've seen throughout sports at all levels, you know, professional, NCAA, high school, the mental health conversation has been at the forefront. That we're looking at initiatives nationwide where we're focused on the mental health, behavioral health of our student athletes. And so this is a time now to really focus. And I know within high schools, it's not so easy because resources can be limited. So many times it's not so easy to find a referral or to find a way that we can seek and access service. And that's something that I'm passionate about. So at Rutgers, we're developing a clinic within the graduate school to be able to service high schools or the community, because this is something that as our graduate school, we're committed to these issues of social justice and access to care. Our athletes are resilient, so I think that I am constantly reminding my team that we're hearing and we're seeing that numbers are increasing and athletes are resilient. And so especially in high school, but mental health is real. So being mindful that we are likely minimizing some symptoms and so that we can at least create space. So space to have this conversation, because really what we know is that based on the data, anywhere from like 45 to 50% of the general population of adults will have a mental health diagnosis at some point in their lifetime. So that this doesn't, this is not void for our high school athletes. This is something that they're also going to be faced with. So that we want to be sure that we're creating the open space, I think, is critical. One thing that I'm really emphasizing, and I think especially in high school, is be proactive. I think one of the conversations we're seeing is let's see how this plays out. As sports are canceled, let's see how the mental health plays out. I'm saying let's be proactive. So one thing that will help to minimize that impact later on is if we create space. We know that in trauma research, if we create space and have the conversation, we'll decrease, say, like PTSD or other symptoms that are common in certain experiences. What we're experiencing together is a traumatic event. So if we're being proactive, and one way I'm thinking about doing that is with groups. So you can do that as either like a group organization that's heterogeneous of sport, or just a team groups to talk about feelings and what it means to be an athlete in 2020. So I think some conversation I've had with, say, freshmen or seniors is, wow, you're really going to remember your freshman or your senior year, right? Because it's happened during a very unique time. I also encourage us, in terms of the accesses, use the community resources. So as I mentioned, we're developing something, but most doctoral training programs, and New York area, we have many of them, have clinics that are either very low cost or free. And I think that those are opportunities where you can maybe have someone come talk to your team, certainly during a platform like we're using tonight. And so I think that those would be the main things I would say. I'm an optimist. I'm labeled as the calm, cool, and collected person, and I sort of have to be. But I do feel like the athletes we're working with are resilient. Part of why I love this work is that they're super committed to change. And that I think that we are, as long as we position them to have access to that care, I don't anticipate us having any real significant change to these numbers that we have been dealing with in terms of mental health anyway, as we get to this place, whatever the other side of this place is. So I think everyone keeps talking about the new norm or whatever that's going to look like. Let's not wait till that. Let's just do it now.
Thanks for those comments, Pete. A couple of quick questions that have come through from folks who are setting up. So one, can you talk a little bit about what you've seen among student athletes, high school athletes, specifically related to COVID? What kind of experiences have they had, and what kind of challenges has that presented from a mental health perspective? And then I have one more follow-up for you about that.
Yeah, thank you. I mean, it's an interesting question because on one hand, we expect, and I think it does vary geographically. So I know I feel optimistic, Dr. Prashad, hearing your opening statements about that we're good, transmission rates, and that New Jersey's in a good place. I think that's where we've benefited by being the first state hit. So as we see in these different areas of the world, we're sort of like at a time lapse. So I think I have found, and that's why I've been focusing on resilience, that some athletes I've worked with, especially I think high school, collegiate, professional, have been relieved, right? So there's a little sense of relief of like, wow, I got a longer break than I've ever had in my life. Whereas the other dialectic of that is that sport is coping. So if I take away this thing that is my coping mechanism, it's likely that I'm going to have an increase of mental health symptoms. And so I think let's not wait for that. I think I've seen everything in that spectrum. So to go back to the question of relief to, oh, wow, I've lost my entire identity. And that's all really workable. And so everything in the middle is what we're trying to work with. And I think I'll let you ask your other question, but one thing I want to say, especially for high school and anyone attending tonight, is also use the weather. So like mental health is directly connected to physical exercise and also like vitamin D and just being outside. So one of the things I'm doing proactively is being sure that we're focused on getting as much fresh air and outside time as we can while we can in New Jersey, because that will change as we get into the fall and winter seasons.
Great, thanks for those comments. Very insightful. You sort of answered my other question, which was more specifically specifically for athletes who are addressing all these changes that have wrought. I lost a season. I lost my position. This was the year that I was going to be the catcher. I was going to be the starting pitcher. I was going to be for singles. Any advice or comments to everybody on the call about how you cope with some of those things and what steps people can take?
Yeah, those are real. And I think one of the things where we're really seeing that is Olympic athletes, because there's so much uncertainty around where, for Tokyo. And I think that that's something that is creating a lot of stress for folks, because anyone that's in an Olympic sport knows that we spend our life up to that, let alone the certain 1 or 2 years outside of the event. So I think that uncertainty is what we work with. So whether your season was canceled or whether you're not sure if you're going to have your Summer Olympics coming up, we work on an acceptance-based, mindfulness-based strategies of understanding uncertainty, understanding what's important to me in this moment, and that this is fluid. So what's important to me today might be different tomorrow, and certainly will be different next year. So I think once we can get to understand that and accept that, we can better manage, and what we call psychological or cognitive flexibility. So can I approach a thing that is constantly changing in a way that's most effective for me?
Great. Thank you, Dr. Economou. Great insight. We're going to switch topics again here and focus a little bit more directly on high school sports in New Jersey. We're fortunate that both Dr. Kripsak and Dr. Krzysztofiak both have a lot of experience in different ways in this area. I'm going to have them both comment a little bit on some specific areas, and we'll answer some questions. So first, Dr. Kripsak, maybe you can talk a little bit about all of the changing. I know you've had in the past involvement at a leadership level in New Jersey sports, and maybe you can comment a little bit on the recommendations and how they're developed and how they might change and how they are changing, and constantly we have a constant state of uncertainty here. Maybe you can talk about the recommendations and how everyone can sort of follow through with being a part of that process of making sure that we can safely compete this fall.
If you guys can hear me, right? Okay, so a couple things along those lines. You know, when you look at how the club sports did this summer, I've taken a poll amongst a lot of club sport leaders, and things have gone very well. There have been very few cases of COVID-19 amongst the players that participated in baseball, softball, boys and girls lacrosse this summer, which has been very good. And I think that speaks a lot to the fact that with the club sports, they kind of created their own little bubble. Your parents took you to a game on a tournament on the weekend. You didn't stay in a hotel. You practiced in your pods or your small groups during the week. The clubs were very quick to shut down a pod or a team if one member came down with COVID or had a family member coming down with it. So I think everyone was very proactive this summer and took it very seriously. And then you look at what's happened at University of North Carolina. Now, school's back in session and you've got, the school shut down. So, Colleen McGuire from the New Jersey Interscholastic Athletics Association put out a video saying, it's up to the students. If you want to have a season, you're going to have to behave yourselves. You're going to have to watch it going to parties. You're going to have to watch the social distancing, wear a mask, and really behave. Because if you want to have a season, you don't want to end up like University of North Carolina. You want to end up well behaved like the club teams did and be able to finish your season. So I think that's one message that I'd really like to get across to everyone, that it's very important that we be very diligent about our activities outside the field of play. Because again, like you said, Josh, it's not really on the field of play that the problem, it's all your behavior outside of the field of play that can really ruin your season. When you look about how teams can be affected by someone coming down with COVID, it can have a tremendous domino effect. So if you have a player on your team that comes down with COVID, this is going to affect your whole team. Your team's going to be shut down for 2 weeks. These are CDC guidelines that if you are in close contact with someone, you're going to have to shut down. So you really don't want to have that happen. And one of the things that came up, it was in a lacrosse club team that I work with. And I think this is really important for a lot of the coaches and athletic directors to understand the kids is, we started out in the summer with the small pods of 10 and then progressed to 25 and 50. It's because we didn't want to wipe out a whole team. We wanted to keep the pods together so there was no crossover amongst the pods, so that they didn't cross the infection over. So one of the things, especially with the smaller Group 1 and Group 2 schools, is it's probably this year not a good idea to have, say, a sophomore play on the JV team and the varsity team, because if that sophomore was to play a Monday game and then you found out several days later that a player on the team that they played came down with COVID and you played against that player on the JV team and then you're practicing or playing with the varsity team, then you just wiped out your JV team and your varsity team. So I know that might be a great challenge, especially in football, maybe in soccer, where some kids swing between different teams. But I think for this year, that could be a very dangerous prospect, because you don't want to wipe out a team by cross-contaminating from another team.
Great, thanks, Jack. That's great insight and specific information about sports teams and the relationship of the pod structure, and how the change from what the summer looked like early on with everybody doing very protected activities to this later time right now where people are practicing in full and people are playing. There's tournaments, there's scrimmages going on. High schools have entered into preseason workouts, and many of those things have more engagement. And obviously, we're not that far away from, and I'm super excited for, and I'm sure most of you are super excited for real sports at the high school level to play in the fall. But that caution is about thinking through how we divide and conquer, so to speak, those pods is really important. I'm going to turn to Dr. Krzysztofiak. If you can give us a little bit of information about precautions that people are taking and how safety is being conducted at different places and screening. Dr. Lander referenced the PPE, the pre-participation exam. So maybe you could talk a little bit about screening and precautions.
Sure. Thank you, Josh. And thank you, everyone, who's on tonight. Before I touch upon that, I just wanted to just say a few comments in general. So, as medical director of the Moorhan Center for Athletes and as well as the medical director for sports medicine at St. Barnabas Medical Center, I'm proud to say that we manage over 30 school contracts in the state of New Jersey, including Division I collegiate contracts, as well as some professional affiliations. Through this whole pandemic leading up until this day and going forward, safety has been and will continue to be our primary focus for the student athlete. To share a dearest quote of mine past as prelude, I can say that our COVID-19 knowledge base has expanded through the months, but there are still many unknowns. With that, I think it's fair to say that we're still at the tip of the iceberg, but to be rest assured to everyone on this phone call, a lot of our experts and physician colleagues and contacts, as well as information we get through many different resources, we have developed many protocols and precautions that have been specifically developed and have been followed to mitigate the risk, the inherent risk of COVID-19 surrounding sports participation. The situation, we've kind of, Dr. Lander said this already, the situation is very fluid, and us as a system, as well as through all our different contacts, we have been adapting protocols and procedures to ensure the safety of our student athletes because the situation is very fluid. Now, the one thing that I keep on mentioning is procedures and policies and protocols, and we have done a lot of things different. A lot of people you probably recognized already, some things feel different this year, and it's not just knowing that there's a pandemic. If your son or daughter are going for they get their paperwork done before they even enter into the physical process, you can see that there was already questions that were added, COVID-19 questions that were added. And these questions were important because if they are answered in a positive fashion, that could have prompted a more formal medical evaluation prior to getting to the PPE or pre-participation physical. And that could have prompted maybe your son or daughter to have COVID-19 testing. It could have prompted one of your family members to get COVID-19 testing, or if it was, the case, a cardiovascular evaluation to make sure it was safe to go forward throughout the process. So, from a precaution standpoint, just right off the bat, the paperwork is a little bit different this year. Moving on to the physical process itself, for a lot of the physicals that I helped out with, we had to make sure that things were different. It wasn't going to be 200 people showing up at the same time for a physical. So actually just strategizing with our school partners to making sure everyone was safe, including the parents dropping their sons or daughters off. That was a really big part of our process. So as you can already tell, if your son or daughter had a physical thus far, it was a little bit different. There was social distancing. People were scheduled differently. Temperatures were being checked. Questionnaires were being done to make sure no one was coming symptomatic that could be positive for COVID-19. Obviously, masking, which is a very big part of it. The physical distancing, again, very big part of it. There was a re-emphasis on making sure that the areas that were being utilized by our student athletes and our physician colleagues were being cleaned every single visit. Equipment was being cleaned. Good hygiene practices were being promoted. These are things that would happen anyway, but again, there is a re-emphasis on this, especially during the pandemic. The actual, there's been education at very different levels amongst the staff, including coaches, the medical staff, nurses, assistants, you name it. If everyone's involved in being around the student athlete or son or daughter, there has been education pieces to make sure everyone's educated as best as possible on the most updated information around COVID-19. And this is really important because one of the best ways of actually just not getting the virus is just not being exposed to it. And I know that seems really simple just to say, but it's actually one thing that has been working, and it's been actually working well for our healthcare system since we've been going. A lot of the policies are in place are just designed to promote a stay at home if you're sick mentality. I remember when I played sports, it didn't make a difference if I had, you name it, I played. And that was a different mentality back then. That is no longer the same mentality. Or, for the parents out there right now, yeah, if Monday through Friday, whatever your work schedule is, if you're sick, I'm going to work. I have to be at work, no matter if I'm sick or not. Again, there's a change in that mentality. Stay home if you're sick. Stay home from work if you're sick. Stay home from school if you're sick. It goes a long way of preventing the spread of this virus. And as Josh was mentioning before, Dr. B, it's really important to know that our numbers are at a good place in New Jersey, but to keep them that way, keeping that message firm is going to go a very long way, especially with schools starting again. Along the same precautions, we're constantly following updated CDC, Center for Disease Control protocols. They're very dynamic. They're likely to change. Who knows? They could be changing right now. We can get off the call and go online and there could be an updated protocol. That is not uncommon for us to have to constantly be on the fly to make sure that we're providing the most up-to-date information for our student athletes and our school partners. So that's another big part of it. The overall message of safety around it. It is a different feel, I can say, watching a lot of practices that were going on recently. It is a different feel to watch people socially distance when they're not in the play, to put a mask on the sideline if they're not actively participating, to have more hand washing apparatuses at practices and more hand sanitizers, recognition of someone is ill. We have for a lot of our athletes, we constantly ask on a daily basis if they're having any symptoms of illness, and if they just have one, we actually triage that and we clinically work that up to make sure that we're not missing anything and not have that individual around other individuals, who could potentially be spreading COVID-19. Precautions during team activities are being followed, also when possible. At the actual athletics itself, it's really challenging to be completely socially distanced and wearing a mask. So those things are not recommended. Those things should not be happening. But everyone else is following protocols to make sure that when possible, physical distancing as well as mask wearing and good hand hygiene, hygiene is being followed. And these are really important. What I'd like to also share is that, through my athletic affiliations, I can say that I was a lead contact tracer from a high-level collegiate sport team. I spent many, I can't say enough, many hours doing contact tracing for one of our collegiate partners. And I feel very comfortable saying this, that a lot of the spread for this virus I can speak for this at the collegiate level, was actually through social interactions, such as household contacts, simply just eating, obviously if you can't eat with or wearing a mask, eating too close to someone without a mask on, and just in general, just having a conversation. I really did not see, my contact tracing did not really lead to too much sport to sport or physical contact during athletics itself. I think that needs to be further researched, and that is currently being researched. But anecdotally, through my experience and our experience as a healthcare system, it does seem that the athletics itself does present a low risk. There is a risk, as Dr. B was mentioning. As anything, there's a risk. You go to the food store, you go to a graduation party. There is a risk. But I feel comfortable saying that I think it's still an overall low risk comparatively, because all of these precautions and policies are in place that we developed.
Dr. Christopher, for that information. That was a really insightful topic. Just two things to illuminate on in that conversation. I think one of the things I think all of our panelists would say, and I would say based on my experience in collegiate athletics, has been that this idea of staying home is a very difficult challenge for athletes, because we've taught ourselves as athletes, and we've taught our kids who are athletes and our coaches to evaluate and to appreciate and to always want to be there, and coming, playing somewhat hurt, or playing through pain or playing injured, coming to work, like Dr. Krzysztofiak said, that's been an inherent part of our culture. And I can speak specifically about Rutgers athletics. We invented a new saying that we told all of our coaches and teams and others, which was "Heroes stay home." And so we've been telling everyone, "Heroes stay home." Actually, instead of coming and infecting your whole team because you don't feel well, or infecting your whole workplace, or infecting your family, we've actually said, and look, we've had people come and say, "Hey, I have a headache today." We've said, "Stay home." And so I think that that's a real important message to get everybody who's in either a student athlete, parents of a student athlete, coaches, athletic directors, is that it's a new mindset, which is really challenging to do that. The second one, Dr. Krzysztofiak and Dr. Kripsat mentioned contact tracing. And so that's the process by which we find out who was in contact with someone who is ill with COVID-19 or any other disease for that matter. And I think some of the challenges that come up with this is that that's also an uncomfortable position that everybody find themselves in. So when a medical professional or a Department of Health or a public health official who technically are responsible for contact tracing, public health is responsible, when they call and ask questions of a person who has COVID, they ask about who are your contacts, who were you with, what social gatherings did you go to, where have you been in the last 7 to 10 days. That's an uncomfortable position to be in the first place, to get a call from a public health agency. Second of all, you're being a big snitch is the word we hear from everybody. I feel like a snitch. I feel like I ratted everybody out. And I told everybody that, now you're going to get quarantined too. And that's the truth. Actually, that's exactly what's going to happen. And that's what's supposed to happen, especially because the risk of not quarantining people who are potential folks who might develop the virus in the future and spread it to others. That's how we get a giant outbreak. That's how you end 4 weeks of sports. That's how you end a season when you have a ton of people on a team who get sick. And so that ability to tell the truth despite being in an uncomfortable position is so critical and so hard. Maybe Dr. Kripczak, if you can just comment, I know that that's been a discussion at many levels, club that you've been exposed to at the high school level. Maybe you just wanted to comment on that conversation and how that might play out in sports.
Sure. Yeah, it's difficult to, like you said, snitch out, but I think it's very important because if you don't divulge the proper information, as I stated before, the domino effect can be devastating because it doesn't just affect your team, it affects other teams, and it can pretty much wipe out a season. Because if the way you look at the quarantine rules from the CDC, if you don't control this quickly and keep it under wraps, you might not just be out for 10 days or 14 days. You could end up being out for a month and missing your season. Because let's just say that somebody on the team has it, and so now you're quarantined for 2 weeks, but you didn't tell about certain kids didn't divulge that they had it, or they divulge it later on down the line, and then your clock can reset, and then you're going to be out another 2 weeks that you shouldn't have to be out. So everyone has to be informed. If you live at home and your team was exposed and your sister plays on the soccer team, well, guess what? It affects her. And then if she gets it, and then it affects her team further, because then the clock resets further down for them to be out longer. So it's very, very important that everyone knows what the COVID status is right from the get-go, and to squash it as soon as possible.
Great, thank you for that commentary. Dr. Krzysztofiak, maybe you can just comment on some of the need for precautions among a household. This is a real challenge that we dealt with. Many of us have dealt with throughout this pandemic, as people who are at work get sick and then they come home to their families. But specifically with athletes, that's a challenge. Maybe you can just comment on household precautions a little bit as well.
Sure, absolutely. So these are very challenging, depending on the different living situation, living environment. Even more challenging for people living in an apartment dorm-like setting. But in general, there's a theme, and the theme is, when you're home and someone else is sick, the easiest thing to do is to do a self-isolation, shelter-in-place like mechanism, where you're just going to stay away from that person at all costs. Essentially, you can do a quarantine within a very singular room, and as long as you're wearing a mask and staying 6 feet away from physical distance, making sure you're washing your hands, practicing good hygiene. Those are some of the general recommendations. But now you're talking about a larger structure where you can come in contact with a lot of household objects, and especially if you're sharing spaces, such as if you're sharing a bathroom or if you're sharing a kitchen. So in general, some of those precautions, and you can find them on the CDC website. There is a really good list of cleaning reagents that are certified to be able to, attack and kill the coronavirus and provide some sanitation. We talk about cleaning common surfaces that are common or shared surfaces, such as tables, desks, computer keyboards, computer mouses, for video games, computer controllers, smart devices. Even when it comes down to pens, we usually tell individuals not to share things that could have been probably shared, such as cups, utensils, toothbrushes, even sometimes hairbrushes. So anything of a shared nature, we usually say this is a good time to refrain from sharing those objects, and really looking around the house at common objects that are and surfaces that are touched, and cleaning those, in between, especially if there's an individual that is sick, for example. So if there is, you have a son or a daughter, if a son and a daughter, and the daughter is suspected or known to have COVID, and she's quarantined in one portion of the house, the idea would be for everyone else to maintain physical distance, make sure everyone's wearing a mask, and then making sure all these surfaces are being cleaned by CDC or EPA approved reagents. So it's amazing. We're coming up with a recent list It actually took, I think, about 5 individuals to really put together about how many different objects you can actually touch in the house. It literally is really endless when you really think about it. So as a general rule, if it's being touched by more than one person, give your best efforts to clean it, and really stick by that mentality of good mask wearing, physical distance, and good hand and body hygiene.
Great, thanks so much. So now I'm going to turn to each of our panelists and just ask them a similar question, just so you can hear some opinions from everybody. I think you heard from everybody on our panel, and include myself in that. We believe that there is a risk to participating in sports from COVID. I think you heard that, but that there's a way to mitigate it. There's things that can be done to make it more safe, more effective, but that there is a definitive risk. We don't want to hide and shy away from that. If we don't acknowledge the risk, then we have no chance of preventing it or mitigating pieces of it. So I'm going to ask each of you. I'll start with Dr. Lander. What's the final message you'd like to send to everyone who's listening and watching tonight? Our coaches, our athletes, our athletic directors, athletic trainers. What's the message you'd like to give to them?
Sure. I think everyone's made some great points tonight, some great information. And as we already mentioned, new information will be coming along. This is going to be changing. This is fluid, it's dynamic, and each week we learn more about the process and what we need to do to stay safe. I'm optimistic that we can have a safe return to play, and I'm optimistic we can have a safe continue to play. Two main things. One is, I just ask that everybody stay safe, not just on the fields, but off the fields. This is probably even more important, or just as important. And the second thing is to the parents, to the athletes, to the coaches out there, if you're uncertain, if you have a question about a protocol, you're just not sure what the next best thing to do is, reach out to your local health professionals. They can help you with the answers. Reach out to, I'm sure anyone on the panel will be happy to field questions and help out our local communities to stay safe and keep sports going.
Great, thanks, Jeff. Dr. Economou, question to you. What message would you like to give to those watching this evening?
It's important that you take care of yourself first. So as I said, the metaphor of putting your mask on before you can put on a loved one. So that's critical, making sure that you're healthy, you're safe, and that you're feeling secure. Don't wait. I think the key here is being proactive. This is the case for any behavioral health issue. You don't want to wait till rock bottom, like many of us have heard. You want to try and get to it before. And lastly, I think the idea that you've heard from all the experts on the panel is that things are constantly changing. So find a way of understanding what that means to you, practicing some acceptance, and I'm a big proponent for any kind of mindfulness or meditation that maybe you're willing to integrate into your life.
Thanks, Pete. Dr. Kripsak, comments to the group?
Sure. So, we want to protect ourselves. We want to protect our teammates. We want to protect our family and friends. I read something on a little news blast the other day. There was a poll of the difference between men and women wearing masks, and men tend not to wear their masks as much as women. It's a supposed machismo thing that I'm not going to wear my mask, but that's not a smart idea. I mean, we've been wearing masks in New Jersey, and I think it's worked well for us. I have a daughter that's going to school down in South Carolina right now, and no one wears a mask down there, and it's a hot spot. And if we want to have a season, we need to practice good hygiene and, realize that the world that we've known it is changing, and we have to change and accommodate with what's going on. The virus doesn't care what we want. The virus wants what it wants, and it's going to go after us. And if we don't fight the virus the smartest way we can, we're going to be in trouble. And I think we have to recognize that the virus just doesn't care about us, and we have to take care of ourselves.
Dr. Kripsak and Dr. Krzysztofiak, what would you like to close with to all of our watchers this evening?
Sure. I think it's safe to say we're all the people on the panelists, we're all sports enthusiasts, and we are deeply embedded to all the sport teams that we take care of. And with that said, I personally understand. I personally understand that right now there is a push. Being competitive, I can tell you that I am competitive in anything that I do within my life. And if there's a chance to win, I want to win. So I understand that inherent from all the coaches and the athletic directors and the parents and the student athletes on the call. I get it. You guys want to go 100%, go forward and go as fast as possible and be as strong as possible and win as much as possible. And yeah, we're 100% behind that. And I think that I'm really optimistic that we can move forward, with this pandemic and be successful. But my one takeaway message that it is okay when you're going lightning speed forward. If you find yourself in trouble, if you think that you may be sick, if you think that something doesn't seem right, it is okay to push pause. We have done that, taking care of patients. We needed to do that, taking care of some of our patients. So it's okay to hit pause for a second, stop. The game will be there tomorrow, and if it takes a medical evaluation or reevaluating how practices are being done or how something is being done, that is okay. I mean, that is the one message it is okay to press pause and make sure things are safe to move forward.
Great. Thank you, Dr. Krzysztofiak. So final comments. Again, I think what you heard from our panel this evening is that we believe that it is safe to play sports. There is definitive risk involved in playing sports during a pandemic, but that those risks can be mitigated to a great degree. And the key factors in that are the social and cultural behaviors that we need to do of social distancing or physical distancing, wearing a mask when appropriate, and washing our hands, and following the public health and health professional directions. And a couple of attributes that I think have been helpful for all of us as we've gone through this. So one is flexibility. I would urge all of you to be flexible in, hey, we were going in, I can think of many a late evening, early morning on a weekend conversation where we were going in one direction and we pivoted and went 180 degrees the other direction because we learned some new information or something happened. So flexibility, as Dr. Krzysztofiak said, the season's going to be here. There's going to be a time to play. Sometimes that extra aggressiveness to get that one extra practice in, or that one extra game, or that one extra might not be the optimal thing to do. So that flexibility is there. The second one is patience and positive intent. So I would urge all of you to assume a positive intent. Everybody is somewhat nervous, somewhat scared in a somewhat struggling time. And the power of positive intent enables you to listen to people, listen to your colleagues, to your teammates, to your friends, to your loved ones, when they are potentially just scared and they're coming at you with a strange request, a strange approach, a strange worded, a strange ask. And if you assume that they're coming at this from a good place, you eliminate a lot of nonsense and a lot of conflict. It's bad enough that we have a pandemic right here. And if you assume positive intent, we can eliminate a lot of the nonsense that goes along in conflict that's unnecessary. So in conclusion, I wish you all a happy and healthy fall season, a competitive fall season. I wish you all lots of success on and off the field. And I'm going to turn it back over to Diana for some closing comments.
I just want to thank all our physicians on our webinar tonight. You guys did a fantastic job. I think some of these messages were really crucial, and I want to thank everyone on tonight for giving us an hour of your time and hearing some of these messages that our doctors worked really hard to put together, and for also giving us your input, your concerns, and giving us the motivation to put this together for all of you. So. Have a great night. Thank you for joining us, and we look forward to seeing or talking to you again soon. Take care.